Standards of Nursing Practice by Erica Nicola, Nurse 321 for Patricia Shedd. The scope of nursing practice. The American Nurses Association, the professional organization for all registered nurses, has long assumed the responsibility for developing and maintaining the scope of practice statement and standards that apply to the practice of all professional nurses, and also serve as a template for evaluating of nursing specialty practice. The American Nurses Association sets the bar for all nurses. The scope of nursing practice describes the who, what, where, when, why, and how of nursing practice. This encompasses all entities of the nursing practice. This describes what nurses do, who they serve, when and where there is need for nursing knowledge, and how nurses practice professionally. The scope of practice describes the services that a qualified health professional is deemed competent to perform and permitted to undertake in keeping with the terms of their professional license. The standards of nursing practice. The standards are authoritative statements of the duties that all registered nurses, regardless of role, population, or specialty, are expected to perform competently. These give the nurse a clear and concise set of guidelines to follow to practice safely and efficiently. Who do these standards protect? They protect the nurse by giving them a clear and concise set of guidelines to follow to practice safely and efficiently. These guidelines are also set in place to protect the patient. These standards protect that the patient is cared for within the nurse's scope of practice and that the nurse follows their professional guidelines. The standards of professional nursing practice consist of the standards of practice and the standards of professional performance. The standards of practice describe the nursing process. The American Nurses Association describes these standards of practice as follows. Standard 1, assessment. The registered nurse collects pertinent data and information relative to the healthcare consumer's health or situation. Diagnosis. The registered nurse analyzes the assessment data to determine actual or potential diagnosis, problems, and issues. Outcomes identification. The registered nurse identifies expected outcomes for a plan individualized to the healthcare consumer or the situation. Planning. The registered nurse develops a plan that prescribes strategies to attain expected measurable outcomes. Implementation. The registered nurse implements the identified plan. Coordination of care. The registered nurse coordinates care delivery. Health teaching and health promotion. The registered nurse employs strategies to promote health in a safe environment. Standard 6. The registered nurse evaluates the progress toward attainment of goals and outcomes. Standards of professional performance. The standards of professional performance gives a professional code for nurses to follow. The American Nurses Association describes the standards of professional performance as follows. Standard 7, ethics. The registered nurse practices ethically. Standard 8, culturally congruent practice. The registered nurse participates in a manner that is congruent with cultural diversity and inclusion principles. Standard 9, communication. The registered nurse communicates effectively in all areas of practice. Standard 10, collaboration. The registered nurse collaborates with the healthcare consumer and other key stakeholders in the conduct of nursing practice. Standard 11, leadership. The registered nurse leads with the professional practice setting and the profession. Standard 12, education. The registered nurse seeks knowledge and competence that reflects current nursing practice and promotes futuristic thinking. These standards allow the nurse to ethically and safely practice. Along with the American Nurses Association scope and standards, there is a Nurse Practice Act. The state duty to protect those who receive nursing care is the basis for a nursing license. Safe, competent nursing practice is grounded in the law as written in the State Nurse Practice Act and the state rules and regulations. Together, the Nurse Practice Act and rules and regulations guide and govern nursing practice. These vary by state and have participants like state or territorial boards of nursing, legislators, lobbyists, National Council of State Boards Nursing, healthcare advocacy groups, and many more. The Standards of Practice and Nurse Practice Acts protect the nurse and the patient. They allow for safe and ethical care and give the nurse a set of guidelines to follow. Thank you very much.